Hi, welcome to Health is a Verb with Dr. Barnes. And today I'm joined with one of my favorite people. Please introduce yourself.
Hello, my name is Chiravo Daisy Catherine. I'm a student currently pursuing a degree in statistics at Makerere University. I'm a youth mentor. I also do social media management, and I'm also passionate about mental health. That's genuinely what I do.
Wow. When I was your age, my CV was not that long. So this is very impressive. Very welcome to the channel.
Thank you so much. Thank you for having me.
Today we're going to discuss health in a fun, creative, and exciting way because, again, I'm with Gen Z. And a number of you have seen this game online. It's called Two Truths and One Lie. We'll do this in the health version. And I'll be the one giving the two truths and the lie, and Daisy will be picking out what the lie is, and we can talk about that after, okay? So
fun.
I'll be making reference through my phone, and Daisy hasn't seen any of these, so let's see how much you know about health today.
Yeah. I'm excited.
You're excited?
Yeah.
Nervous?
No.
There are no marks, there are no presents, just...
There's no present.
There's no present. There's no presents. You'll get bragging rights. Okay, so the first one, again, you're meant to pick out the lie.
The lie.
Yeah. The first one, babies have more bones than adults. Then our weight is not the only factor determining our health. And the third is our fingernails and hair continue to grow for at least 6 months after we die.
The babies having more bones is a lie.
Babies having more bones than adults is a lie.
Yeah.
Final answer? You sure?
Yes. Yeah, that's the final answer. That's the final answer.
It's the final answer. Wrong. It's actually true.
How do babies have more bones
than adults?
in the little science I did, there was no specification. So that's a new one. That's very new. Okay,
so when we are being formed in the womb and after we've come out, the first few years of our lives, the bones are not completely fused. Some bones are not completely fused.
Okay,
yeah,
makes sense.
That means there's some gaps between some bones, and that creates more bones, technically. So it's true. It's true. Adults have 206 bones. Babies have 300 bones.
So you just have an extra of...
There's extras of about 96?
96, yeah.
94. Yeah, there's an extra of 94, but those are bones that eventually fuse. The lie is our fingernails and hair grow after we are dead. They don't. Okay?
I thought because they are dead cells, there's more dead.
No, they don't. Let's go on to the next one.
Okay.
So that one, no points, no bragging rights. This one is about infections. Poor ventilation leads to chest infections.
Okay.
Playing in the rain causes pneumonia and malaria. Infections of the throat and lungs can be spread through poor hand hygiene.
Infections of the throat
and lungs can be spread through poor hand hygiene.
I think that's the lie. No. No. Playing in the rain cannot give you malaria.
Okay. Final answer?
Yes.
Okay. You're right. Playing in the rain does not cause pneumonia or malaria. It's the situations around the cold and long grass growing, water puddles, creating situations that will cause the infections. Good job. You've picked up. Next one. Shisha is safer than cigarettes. Smoking can affect non-smokers. Smoking increases risk of heart disease.
The first one is a lie.
Shisha is safer than cigarettes.
Yeah.
You're right. You're right. Shisha is actually more dangerous than cigarettes. Next one. This one's about dieting. Food and diet and food.
Okay.
Starving yourself is more likely to make you gain weight than lose weight. Water is a nutrient. Eating before bed makes you overweight.
The first one is a lie.
Starving yourself is more likely to make you gain weight than lose weight.
Yeah.
You think it's the other way around? Final answer?
I don't know the science of it, but me, I know it's a lie.
When you starve, you lose weight.
Eating before sleeping, we eat supper. So that's the truth. And then water is definitely a nutrient. Why your face is... Okay.
Don't look at my face.
I stick to my answer. The first one is a lie. I stick to my answer.
So eating before bed makes you overweight is true?
No,
Water is a nutrient
false.
Is true? You're picking the false.
No, the false. Eating before bed makes you overweight. That's false.
That's your answer?
Yes, that's my answer.
You're right. You're right, but I think you cheated.
I didn't cheat.
So are we good? You're satisfied with your answer?
Yes, but I've won. Okay.
Yes, you have. High five. The next one is about us, doctors.
Okay.
Doctors are trained to break bad news.
Okay.
Doctors are trained to write badly so patients don't read their notes.
Okay.
Doctors expect patients to ask questions about their illness and treatment.
Could you repeat the last one?
Doctors expect patients to ask questions about their illness and treatment.
Okay. So the last one is true. I think the one of writing badly, I don't think you guys are trained. So I think that's a false one.
You don't think we are trained, but we just normally write badly?
You just decide to.
We decide.
Why would you hide our prescriptions from us? What is the intention? Wait.
So which, okay, what's your answer before we go into the...
I don't think you guys are trained.
You don't think we are trained, but you agree that we write badly?
Yeah.
We don't write badly.
No, you guys, it's like...
Okay, anyway, you're right, it's false. We are not trained to write badly. We just write in a hurry, not badly.
Even when you have one patient. You still decide.
You're right. So we are trained to break bad news. We are trained. We expect that, you know, when I tell you what your illness is, you can ask questions, ask more details. Yeah, it's better for us if you understand what we are treating. Yeah.
Yes.
UTIs. You know what UTIs are? Urinary tract infections.
Yes, I do.
Yeah. Dehydration is a risk factor for UTIs. UTIs are sexually transmitted. Women are more likely to get UTIs because of their anatomy, the way their body is built.
The second one is false.
The second one is false. UTIs are sexually transmitted. You're right. I like that you know that. UTIs are not sexually transmitted.
Just giving faces to say.
I feel like you needed.
Shall we move to the next one?
Yeah.
No questions so far?
No.
Okay.
If you want to expand on that one, but me, I just have general knowledge on UTIs.
The action of sexual intercourse is a risk factor to getting UTIs, but they are not sexually transmitted. No, your partner cannot give you a UTI. Yeah. Contraceptives, you know what those are?
I've heard of them.
You've heard of them?
Yeah, I have.
Okay, what's your understanding of contraceptives?
Birth control.
Birth control.
Yes.
All right. So you know that there are pills, injections, barrier methods. All right.
Yeah.
Contraceptives prevent STDs, sexually transmitted diseases. Contraceptives prevent pregnancies. Contraceptive effectiveness is affected by your habits and your lifestyle.
Okay. The last two are true. The first one is false. I don't think not all, I think I should say that, not all contraceptives protect you from STDs.
Okay. Which contraceptives prevent STDs?
There are some STDs that can be prevented, I think through condoms.
Okay.
But then if you have like the pills and the injection, because you might have no barrier, you might still get a sexually transmitted disease. Yeah.
You sure you're not in medical school?
No.
All right. Right. I can't add to that. I am very proud of you for knowing that. Just two left.
Okay.
Snake bites.
Okay.
You're not supposed to tie the limb after a snake has bitten you or someone, you know.
Okay.
Tying baby snakes or dead snakes are not poisonous. All snake bites should be evaluated by the healthcare provider.
Why would a dead snake bite you? A baby snake and a dead snake are not poisonous. What were they doing biting you? Like, I'm wondering.
Leave the biting.
What
Are
was
they
the
poisonous or are they not?
Okay, what was the first?
The first one is you're not supposed to tie the limb.
I think that's this baby snake and dead snake thing is a lie.
It's a lie. Final answer?
But they'll have poison, even if it's a baby. If it's poisonous, it's poisonous. But the dead one, I think, is also still poisonous. It's poisonous, not disappeared due to its death. They all look true, but I think I'll cancel it out.
So you're just...
I'm not doing picky ponky and the third one.
So the lie is baby snakes and dead snakes are not poisonous.
No. You're not supposed to tie the limb. That's a lie. You're supposed to, you think, leave it open. That's the lie. That's the lie.
The statement is, do not tie. You're not supposed to tie.
Oh, okay, that's true. That's true. Now this baby snake and dead snake thing is a lie.
All right. Final answer?
Final.
You sure?
Yes.
You don't want opportunity
I'm
to
very sure. I'm very sure.
You're right. Baby snakes, dead snakes are still poisonous, and there have been stories of even dead snakes still being able to bite and for several hours.
Okay.
Yeah.
So when we were in school, from the little first aid, I remember they told us that you're not supposed you tie, if the snake beats you, you tie above the snake bite area, you tie a cloth or anything above it so that blood does not move from that spot to your heart. Yes. So is that true? Because since you're saying don't tie, how are those two related?
So two things. Medicine has evolved and keeps evolving over the years, and in the same sense, first aid practices also have evolved over the years.
Yeah.
So I don't know how long ago you were in school, but I've also, even when I was in school, that's what we used to be told. And, even some original texts about first aid and snake bites have that information. But as time has passed and more research has been done, it does not, tying off the limb to prevent blood from flowing upwards to the heart does not do anything, does not do much as far as preventing the poison from creating its harmful effects. Okay? Then secondly, if it's done, that tying, if it's done by someone who's not a health practitioner, it might be it's going to be more harmful.
Yeah.
Most of the time it's going to be more harmful because you don't know where you're tying, what you're tying, and for how long you're tying that limb before you get to a hospital, before someone comes to help you. So untying a limb becomes a dangerous problem.
Okay.
Tying a limb becomes more dangerous in that regard. Yeah. So the best thing to do when you get a snake bite is find help. Get to a healthcare practitioner as soon as possible.
Okay.
Yeah. Cover the wound maybe with a cloth and find help.
Okay.
Yeah. Also, don't chase after the snake. It might bite you as well. Yeah. So, final one. You're doing well. Have you been counting how many you've gotten right?
I have done the most. The most I was right.
Okay, so this is about chronic illnesses. You know what chronic illnesses mean? A long-term illness. Yeah. Only adults above 40 can get hypertension.
Okay.
People with diabetes can take sugar.
Okay.
And mental illnesses are chronic illnesses.
I think that's false. Mental illnesses being chronic illnesses. The records show that some mental illnesses are chronic. They can be lifetime, especially if not worked upon. But then that doesn't make them chronic.
Okay.
That makes sense.
So you can
Like
give a treatment
and it goes.
Okay.
Then there was a second one.
The second one was people with diabetes can eat sugar.
Yeah, that's true.
And only adults above 40 can get hypertension.
Oh no, that's false. I think you have two falses because that is not.
You're setting your own question.
No, I've heard of cases, even my age mates, people having hypertension.
Okay.
And either they inherited it from a parent or they just developed it. So I think that's false. But then also I don't think mental health is chronic.
Final answer.
I'm doing those things I used to do in papers where I put up here and I'm like, teacher, this is I know my answer.
It's the right answer. All right. You're actually right. This was a trick one because yes, of course I had to throw in a trick somewhere.
Well, you forgot who you were dealing with.
Yeah, so it's true that you can recover from a mental illness if it's being treated well. And sometimes that can be a short illness and then you're treated. But most of the time, the illness has been around for a while. So that's why most mental illnesses are said to be chronic illnesses. But it's possible to find it early and treat it in time.
Okay.
Yeah. Okay. Well done.
Thank you.
So how many have you gotten? These were 10.
I failed one. I failed the first one. One of baby bones. Baby's bone. I failed the first one.
And cheated on 2.
Which 2 did I cheat on?
The snake thing.
I didn't cheat.
the snake thing, and I don't know which one else. So this was good, right?
Yeah.
Exciting?
It was fun.
Have you learned something new?
Yes.
Okay. Is there something you'd want to tell our viewers on the Dr. Barnes channel about lifestyle, especially people your age?
Okay. Don't play with baby snakes. Anyway, that's just a joke. But I think we need to be more aware about our health, because some of these things we take lightly, but when we're aware of them, they can help us to be able to detect things early and reach out for help. Yeah, I think that's the best I could tell people. And this was fun. I'm happy to be here. I've had so much fun playing this game, and I've won, so I'm happy. Yeah, thank you for having me.
I'm glad I had you here. You keep me young. And like you can see, health is not always about serious conversations and sit up straight. We can always have fun ways of learning something new. So come back next time for some more information. Like she said, be aware about your health. You can always find more information about your health from the Dr. Barnes channel, where health is a verb. So until next time, bye.